Hi everyone, hope you're doing well. Happy gorgeous Friday, happy homecoming weekend to Howard University and to University of Maryland. Hope everyone's enjoying some well-deserved time with friends and reunions and all that good stuff. Today on Whitman-Walker's Instagram Live, we're going to be talking about getting tested as part of your routine. If you are in need of HIV or STI testing, you can always call Whitman-Walker at 202-797-4439 to schedule an HIV or STI testing appointment. It's just super important to get tested regularly. If you're sexually active, you want to get tested every couple of months, at least twice a year, but also every 3 months is a really good rule of thumb. So we're just going to get Whitman-Walker in the room. Every 3 months is that HIV, like after an HIV exposure, it can take up to 90 days or 3 months for it to show up as positive on a test result. So it's just important to practice getting tested often and routinely if you are a sexually active person. So during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. My name is Jewel, and I use she, her pronouns, and I work to bring educational Instagram Lives to this space with Whitman-Walker's community health team. Today we're going to discuss getting tested as part of your routine, again, because it's just a huge and a very impactful part of your healthcare. So I've personally taken so many STI tests and HIV tests out of precaution and routine, and I've been fortunate to be a person who can introduce just practicing getting tested to their friends, family, and former sex partners, because it's an important practice. I think it also helps people get comfortable with having conversations about getting tested and about sexual health. And so it's something that I hope that they are more comfortable with practicing and discussing moving forward with their significant others and whatnot. So I guess an important thing to discuss is, why do we get tested? What's the importance of getting tested? We get tested to catch and to treat STIs. So STIs are sexually transmitted infections that are spread from one person to another, usually through vaginal or front hole, anal or oral sex, or any combination of those three things. They're really common, and lots of people who have them often don't have any symptoms. So it's super easy to just kind of keep on living your life and continuing to be a sexually active person and not know that you have an STI, just because they can be symptomless. Without treatment, STIs can lead to serious health problems, but the good news is that STIs are super easy to treat. So you want to get tested routinely and regularly, depending on how sexually active you are, to catch STIs and just to make sure you're in good health and not spreading them to other people or sharing them with other people. Now, when you're seeing your provider, or when you go to the doctor's office, or just going for your annual checkups, it's super important to talk to your provider about sexual health. If you're a sexually active person or have had barrier-free or condom-less sex, it's important to get tested. And getting tested every 3 to 6 months is a good starting point. Your doctor or medical provider can recommend ways to stay safe in your sexual relationships. You might also find ways to prevent certain diseases. Sexual health can be an intimidating topic to bring up, and you may even have concerns about disclosing your sexual identity and orientation to your doctor. But this is why seeking out care at places that are LGBTQ inclusive, like Whitman-Walker Health, can go a really long way in supporting your sexual health. The conversations that you have in an exam room with your medical provider are confidential, and your doctor or provider are bound by law in the United States to protect your personal information. Thank you, HIPAA. Honest dialogue between you and your healthcare provider can help you learn the conditions you may be at risk for and how to prevent them, as well as if you have any current diagnosis related to your sexual health. And remember, if you ever feel disrespected or uncomfortable or unseen during your exam, you can seek out a new provider. You don't have to stay with that person or keep seeing that person. Like, you should be comfortable in healthcare spaces. And so keep on looking for that provider until you find the right one. Also, don't hesitate to report anything that's inappropriate, as you have the right to do that. Now, the possibilities of infections and diseases is as much a part of sex as the fun of sex is. So all genders and bodies can be infected with STIs. Knowledge is power when it comes to sexual health, and recognizing the symptoms is a start, but you won't always notice symptoms for things like chlamydia, gonorrhea, herpes, or other STIs, as again, they often don't show any symptoms at all. You'll need to get tested to know if you have an STI and to protect yourself as well as your sex partners. So fortunately, a lot of the common STIs can be treated and most can be cured as well. It's also important to get tested in all areas that you've had sex in. So, for example, if you go to get tested after having anal sex and oral sex, you can't just swab your throat and hope to find out if you have an STI that is actually in your anus. So it's easy if your provider or your doctor's office isn't asking you about the types of sex that you're having, they might just think that they only need to swab you in one area where they need to swab you in multiple areas because, again, that test will come back negative for an STI in your throat, but will come back positive for an STI in your anus. But if they didn't swab your anus because they didn't know that you were having anal sex, then they're going to miss that STI, and then you'll kind of go out into the world thinking that you're STI free, continuing to be sexually active, and then putting others at risk of sharing your STI with them. So again, this is why it's super important to go to inclusive healthcare spaces and LGBTQ healthcare spaces and just doctors' offices that understand the types of sex that you're engaging in and are willing to ask what types of sex that you are engaging in. And sometimes this might start with having a conversation about your sexual orientation and them having an understanding of what that means for what kind of sex you are engaging in. All in all, you can learn about Whitman-Walker's testing hours and locations at whitman-walker.org/testing. HIV and STI testing are available at Whitman-Walker's locations, at the Max Robinson Center at 2301 Martin Luther King Jr. Avenue Southeast in Anacostia, and at Whitman-Walker Health at 1525 14th Street near Logan Circle. You can just call 202-797-4439 to schedule a testing appointment, and be sure to check the website for the latest and most up-to-date hours. Again, that number is 202-797-4439. Finally, please join Whitman-Walker for its 36th annual Walk to End HIV tomorrow, Saturday, October 22nd. You can still register to walk or donate at walktoendhiv.org. And you can also register on site in the morning, day of the event. This year's walk will take place at Whitman-Walker's new medical home on the campus of St. Elizabeth's in Congress Heights. And this is the first time the walk's been there. It's usually down at Freedom Plaza, and then it had to pause for a couple of years due to the pandemic, and now it's back for the first time kind of at one location, and it's going to be at Congress Heights. So this is super exciting. On October 26th, you can also join the community health team for an event in honor of Breast and Chest Health Awareness Month, which is this month of October. Come to Crazy Aunt Helen's in Southeast from 5:30 to 7 p.m. and you can register or RSVP to RKEITA at whitman-walker.org. Again, that's RKEITA at whitman-walker.org. All month long, you can also order a Booby Blossom cocktail at Crazy Aunt Helen's, and they're going to donate $1 of the proceeds to Whitman-Walker's Women's Health Department for every cocktail that's sold. Thank you all for taking some time to learn about not foreplay. We talked about that earlier this week. Thanks for taking some time to learn about getting tested as part of your routine and where to get tested, how to prevent HIV and STIs, and how to help support the fight against HIV. Before we go, we want to give you a few reminders about COVID-19 and vaccines because we're in a couple of public health emergencies right now. But if you've already gotten your vaccine, congratulations. You've taken a really important step towards keeping yourself, your loved ones, and your community safe and not sick with illness as relates to COVID. We've seen multiple variants have soared across the world, and it's totally understandable why you might keep wearing your mask when you're outside, especially if you're in places with poor ventilation or what have you, or just super crowded spaces. We also all know that the vaccine is not 100% effective. It doesn't prevent people from getting COVID-19, but it does help you not get super sick with COVID. It helps keep you out of the hospital with COVID, and it helps prevent death related to COVID. So all in all, keep staying alert. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available. Give them a call at 202-207-2480 to make an appointment. And if you're having trouble making an appointment with them, or it's just not a regional location for you and you're a DC resident, you can call 1-855-363-0333 or visit vaccinate.dc.gov. If you are a Maryland resident, you can visit covidlink.maryland.gov or call 1-855-634-6829. And if you're a Virginia resident, you can visit vaccinate.virginia.gov or call 1-877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, social distancing, quarantining, and the like. It's very important that you think about getting the vaccine, and just discuss COVID precautionary measures with people who are around you, especially when you don't know if they've been vaccinated or not. But be mindful of masks and keep your distance. And finally, our other public health emergency or pandemic currently, monkeypox. So according to the CDC, there are more than 27,000 cases of monkeypox documented in the US. And in DC, you can pre-register for monkeypox vaccine appointments at preventmonkeypox.dc.gov. Virginia is currently working with local care providers to contact trace and identify those who are most in need of the monkeypox vaccine. And varying counties in Maryland are allowing residents to pre-register for monkeypox vaccination. But the Maryland Health Department also released a pre-registration system, so you can always go to the Maryland Health Department's website and register for an appointment, and they will alert you when you are able to schedule one. All in all, please visit your state's local health department for more information on how to register and get vaccinated against monkeypox or mpox. DC Health has some new mpox or monkeypox vaccination clinics located across DC. So one is at 3640 Martin Luther King Jr. Avenue Southeast in Ward 8. One is at 5335 Wisconsin Avenue Northwest in Ward 3. And then the last one is at 926 F Street Northwest in Ward 2. These different locations have varying hours each day of the week, so definitely check the website. Again, that's preventmonkeypox.dc.gov. Just check that website for the hours of operations for vaccinations, but walk-up vaccines are available on a first-come, first-served basis to eligible residents. You are currently eligible to get vaccinated in DC if you are a District of Columbia resident who's 18 years or older. Hey, Coffee Press, thanks for joining. And so if you're a District of Columbia resident who's 18 years or older, you're eligible to get a vaccine. And then also it's anyone who is of any sexual orientation or gender who's had multiple sexual partners in the last 2 weeks, including those who are currently considered highest risk, so folks who identify as gay, bisexual, and other men who have sex with men, transgender men and transgender women, or sex workers of any sexual orientation or gender, or staff of any sexual orientation or gender at establishments where sexual activity occurs, like bathhouses, saunas, and sex clubs. You will need to provide proof of residence prior to your vaccination. So this would include ID cards with a DC address, utility bills or other pieces of mail with your name and a DC address, or a current DC lease or mortgage with your name on it. Remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and check the website www.whitman-walker.org for the most up-to-date information on available services. And for more COVID-19 resources and general Walker services information, you can call them at 202-797-4439. That's the same number you can use to schedule your HIV or STI testing appointment. But all in all, please follow some of their programs and the Whitman-Walker family at Real Talk DC _ and at No Filter DC. Have a great rest of your weekend and happy homecoming.